Okay. Well, while you're finding that, so for this next hour, we are just going to give like an overview of the clinical training at UK, talking about like the practicum sites that we offer, as well as like the in-house training clinic, the Harris Center. So I've met, I think, literally all of you yesterday, at least in the noon thing. But I'm Amber Billingsley. I'm the director of the Harris Center. So I will turn it over to Justin.
All right. Thank you, Amber. Can everyone see me? Or not see me, see the slides? Yeah, is irrelevant if you see me. So my name's Justin Carr. I am the interim co-director of clinical training. So Mary Beth McGathern is on sabbatical this term, but she would be the person you'd be working most closely with. And she will retake this role upon her return, which is a great thing because she's absolutely wonderful. And I accepted this role as of January 1, and I conclude this role as of June 30th. So it is new to me. So I will do my very, very best to explain to you the clinical training in the context of the program. And these slides were developed with Mary Beth in the past, but essentially they just overview the training opportunities that exist here. And as Amber noted, she's the director of the Harris Center in-house clinic, which has a lot of unique training experiences as well. So I will just go over here quickly. Clinical training at UK, we have a clinical science program, but there is a very heavy emphasis on that clinical component. We take a developmental approach to clinical training. We meet, people do join this program, come into this program at all levels of ability. Some people have had previous master's degrees in clinical or counseling. Other people have never or have been on research studies in which they were involved in like assessment protocols. And some folks have never done anything at all clinically, and that's completely okay. We reach people where they are. And the nice thing about our program is it isn't really cookie cutter. It is structured and tailored towards your career goals. As you advance through the program, those may shift. There are opportunities that are available to you that you would want to choose and think about, that might be something different or something new that I'd be interested in trying out. So it is very, very individually tailored. I don't think anybody goes through the program and necessarily does it in the exact same way. And that's based on kind of the diversity of experiences that we have as practicum, but also the coursework. So in terms of coursework, there are ways by which you will be better prepared for doing applied clinical training outside of the context of your courses. So we don't just throw you in there. There's some form of didactic training where you're going to learn about assessment instruments, about approaches to therapy. So this is just an example of some of the courses that are offered. There are assessment courses that are going to teach you about things like intelligence testing and academic testing and personality assessment that you would take, and they also actually have some form of an applied component attached to them. There's also introduction to clinical psychology. There's therapy courses that are going to tell you about how to approach therapy. There's also special topic courses in the context of clinical psychology, so dialectical behavior therapy, trauma-focused therapy, or child psychopathology. I'm the neuropsychology coordinator, so if you're hanging on for the next hour, I'll talk a little bit about what that involves, but that's also a course as well that will have a didactic component focused on assessment methods in the context of the specialty of neuropsychology. And then folks typically have 3 to 4 practica over the course of their clinical training experiences. So what is the practicum process? It is a matching process. People may hear like the match for internship. It's not quite like that. But essentially students submit training goals and we match you with sites that align with those goals. And the whole idea is to find you with sites that align with your goals. It isn't to say, well, this practicum is available, so that's the practicum that you're doing. It's you're going to tell us what practicums you want to do, and we're going to do our darndest to get you to those practica. There are things that are out of our control. Sometimes more than one person wants a practicum in a given year. Sometimes, people go on maternity or paternity leave, or they leave places. So there's environmental and personal things that can happen that could limit the availability of a practicum. But for the most part, Mary Beth has done her due diligence in terms of building relationships with the community to identify practicum experiences outside of the context of our program for people to go to. And you'll hear about them, I'll talk about them, but those are great opportunities for everyone to do. There are a diversity of experiences, and it's really a kind of a cool catchment, I think, that we have a privilege of in Lexington, Kentucky, to just have a number of different experiences that people can try out. One big thing too is we try to identify practica that are meaningful and good training experiences for you all. It isn't like, there are times, I swear, when people will approach us and say, we want a practicum student. And it's like, well, what do you want out of a practicum student? It's essentially like, we want them to work for us for free. And that's not the goal of practicum training. The goal of practicum training is for you to get training that you need to be a good clinician. And that is the primary focus of the sites that are affiliated with our program. So I'm going to list some of them. Not all of them are going to be listed here because there actually are quite a few. But these are just examples of external placement options for early students. So folks who are just starting out doing kind of their first practica. But we also do have work at our in-house Harris Center that Amber will talk about. In terms of, these are the early ones, orofacial pain, kind of an interesting concept of like pain intervention, but the VA is the largest employer of psychologists in the entire world. And if you ever want to work at the VA, you'll find that a lot of veterans will talk about pain. And there are non-pharmacological interventions for pain. And it's a great experience to have learned about interventions for pain, because it is a very common problem in the United States in general, but in populations that have access to mental health care in the United States as well. The counseling center at UK, that will give an opportunity for you all to serve a college age population, early exposure to group and individual therapy with that age group. And then this is kind of cool, the Clinic for Emotional Health, that is CEH. You may have heard CEH be commented on. There's 3 faculty members who are affiliated with that clinic, and they run research clinical trials through there. So it's actually a good opportunity for people to be exposed to different evidence-based interventions. They also have very structured assessment protocols, so like very standardized evidence-based assessment approaches to diagnosing different psychopathology. So those are the 3 of the earlier training opportunities. Students also see cases through the Harris Center, and the Harris Center work is in addition to the external practica. So people kind of have a linkage into the Harris Center that kind of gives you a good experience of kind of having like foundational, good, close mentorship and learning in the context of being a psychologist in an in-house setting, but then also having those external exposures in different environments. This is just an example of some of the practica that are for advanced students that are external. The VA in Lexington actually has a number of different sites where they see our students. So, you know, all sorts of different programs, PTSD oriented. There's one that's like general assessment oriented, and then a neuropsychology assessment rotations available there now, which is really cool. A new neuropsychologist is in town. There's also primary care. So folks who want to engage in healthcare and primary care settings where a veteran's coming in for any sort of problem, and they might actually experience some mental health that would need to be addressed by a psychologist in that setting. A lot of jobs there, a lot of people doing meaningful work in those primary care settings, and it's a cool practicum opportunity. There's also a private practice setting of Mindside that gives access to children, adolescents, and families for those people who want to focus on different age groups or family dynamics. There's actually a forensic hospital of Eastern State Hospital that's an advanced training opportunity for students. The Kentucky Neuroscience Institute is our most advanced neuropsychology training opportunity. It's in a Department of Neurology. There's another cool component of UK having its College of Medicine right across the way. Orofacial pain is affiliated with our College of Medicine. Kentucky Neuroscience Institute is affiliated with our College of Medicine here. And then the Federal Bureau of Prisons. Actually, sometimes we have students who train there. The Bureau of Prisons is actually a really very interesting setting. There are internship sites in Bureau of Prisons that actually have pretty good stipends and actually have very stable and good jobs. So it's a very specific area of interest in terms of work, but kind of a very unique training opportunity. This is redundant, sorry, but the Kentucky Neuroscience Institute has already been mentioned, but Dr. Jordan Harp's actually a graduate of our program, and now he directs that training group over there. There's also a developmental pediatric assessments group that was a recent affiliation with the program, and they provide training in primarily assessment, but focused on different neurodevelopmental disorders that affect young children and adolescents. But some training in different diagnostic instruments, the ADOS for assessments of autism, and the Stanford Binet Intelligence Scales, which very few people use. So it's kind of an interesting opportunity to have exposure to different assessment instruments there. This is actually a larger practice in Lexington, Bluegrass Health Psychology. Very interesting setting where people can kind of take a health psychology approach, which is really like a behavioral health psychology intervention approach to addressing a number of different physical conditions that have co-occurring mental health or behavioral issues that can interfere with them. There's also opportunities for, again, more opportunities for adolescents, those interested in younger age groups. This is another private practice setting where you can see what it's like to operate a private practice, and Heather Risk involves Dr. Risk, is not a risk assessment setting. That's what I initially thought. That's just her name. It involves evidence-based treatments for trauma. There's also a clinic that focuses on obsessive compulsive disorder and eating disorders. And then our own Dr. Michelle Martel supervises in an adolescent inpatient unit, which is actually quite interesting to have a training experience in an inpatient context. That's pretty rare, but a very different type of approach to psychological intervention. And that was a very quick overview of the many practicum sites that we have available. And I can answer questions now, or Dr. Billingsley, would you be interested in taking over and chatting about the Harris Center?
Yeah, I think maybe we could save them till the end, just in case there's any that will, they might ask you that might suddenly be answered by something I say.
Sounds good to me.
All right, let me share this. Okay, can everyone see my full screen? So it should be the whole thing.
Yep.
Okay, just making sure you're not seeing random other stuff. Okay, so I'm going to present on the Harris Center. So as mentioned, I'm the director of the Harris Center. I thought we could start by a quick and maybe slightly crappy tour that I put together. I tried to have a video of filming going through the building, and it was just chaotic and a mess. So I have a picture tour instead, which I think still represents the center pretty well. So I thought I would start there, and then we can talk about the training that you get in the Harris Center next. So this is the Harris Center. We are in a very old house. The house, I think, is over 100 years old. It was built in the 1910s, and it's still standing, and that's amazing. It has not been super renovated on the inside, but there's been a lot of changes recently where we have been able to make some repairs and fix some stuff up, and so it's been really nice to have this standalone functional clinic. We have our own parking lot out back for patients. So very old building, but we're making it work and continuing to improve it. So this is kind of what it looks like when you first come into the Harris Center, and I'm realizing, Justin, all of this might look new to you too, because you have not seen these pictures yet either. But this is what it looks like whenever you come in. So we have a reception desk, a very large, oversized reception desk, actually, right front and center when you go in. And then we have a waiting room as well. So the student who's sitting at the desk right now is one of our clinic assistants. So the clinic assistants that we have at the Harris Center kind of staff the front desk. They check patients in, they take payments, they answer the phone, all of that good stuff. So these are advanced undergraduates who serve in that role. Just another angle of the reception desk, because I didn't have my video tour. I wanted to make sure it was clear that there is a therapist coordinator office, which I'll show in a second, and it's attached. The layout of the building is kind of funky, so I'm trying to make it as clear as I can just through the images. But this doorway goes to the therapist/coordinator office that students can write their notes in or prep for cases or just kind of hang out in while they're waiting for their patients to show up. A brand new development of the Harris Center is now we have a fully stocked snack, coffee, and tea bar that is free for our patients, and they have been loving it. So patients are welcome to come in, get cozy, have like a nice warm tea, and had really good like feedback about this so far, that it's been helpful to staff, patients. It's been great. I am very jazzed about it. The water cooler is also new, so I'm just going to continually point out all of the brand new things that I'm very excited about. And I use the water cooler all day long. So just a better look at our current setup of our waiting room. So you can see we have like lots of space for many patients to come in at once. It's never really full. Sometimes maybe like half of it will be, but we're always like playing nice music whenever patients come in. This is just a different angle of our waiting room, so you can see kind of how it is connecting to the reception, and our brand new sign telling people that we now have this coffee and tea bar. Okay, so this is the therapist office. So this is where you would write your notes. There's a bookshelf over here with tons of different therapy manuals, so you might prep for cases. Or like I said, a lot of students just kind of hang out in there. That's what the ruckus was earlier, is many students hanging out in there right now while they're waiting for afternoon patients to come in. So we have 3 different computer setups, and then this big table in the middle as well, where students can work. This is just a slightly different angle so you can see our bookshelf a little bit better. So when I started back in August, I brought like half of that bookshelf or that bookcase worth of treatment manuals that I had accumulated over my tenure in grad school, postdoc, etc. And so now students are able to check out many different therapy manuals of all kinds of different presenting concerns. This is just, again, because I didn't have a video walkthrough, just showing you how the therapist coordinator office is directly connected to my office. So I have that door open pretty much always, except now when they're being loud and I'm in the middle of something. So students can always like pop their head in and ask questions if they have them. Showing you my office because I often hold group supervision in here. So I have usually groups of like 3 to 4 students, whether I'm working with our graduate student coordinators, which I'll talk about, or just my individual supervision group. We hold it in my office. So just another angle of what that looks like, so you can see kind of how I can see into the therapist coordinator room and how it's very easily accessible to students throughout the day. This is our newly refurbished conference room downstairs. So there are far more chairs in this room. Actually, I don't have a picture of the other ones, but we can move stuff around, set it up for group, we hold classes in there. The clinic assistants have a weekly class as well, which they hold down here. I don't think the angles that I took, you can see this, but there's a very large TV on the wall off to the right of here. And so you can log into the computer and share your screen. There's, what am I saying? There's like a big camera on it. So you can also like zoom from this room if you ever needed to do that. This is just another angle of the conference room kind of going out towards the back door. What is behind this partition thing right now is where our undergraduates do phone screens. We put it up recently just to give them like a little bit more privacy, since our back door is right here to the right, and there's often people like students who are allowed to come through that door coming through and can be kind of disruptive at times. So this just gives them a little bit more privacy if they're like writing contact notes or if they're calling someone about scheduling or something like that. And I will note, typically they're not on the phone when people are actually coming in, but still we don't want people to be able to see that computer. So this is the child therapy room. So this has been kind of recently redone to be a little bit more multi-purpose. So adults can also, I think, comfortably be in this room now. It's not like toys scattered all about. So patients who are seeing child clients can use this room. So they closet is full of like various therapy toys and games, and we have a lot of new materials too that are in this kind of cabinet here that are specifically for our child clients, like various like blocks and dolls and hand puppets, that kind of stuff. We have 4 therapy rooms upstairs. We're skipping room 2 just because I literally could not find a time when someone was not using that room to take a picture of it. It looks almost the same as all of the others, but for whatever reason, room 2 just seems to be by far the most popular. So just imagine that it looks very similar to this one. But this is the 3rd therapy room upstairs. So you can see that plenty of room for patients, therapists. Sometimes if we're doing co-therapy, there's extra chairs in here that you can drag around. And all of the rooms now have this little like testing station as well. So you can move the computer over if you're doing some type of assessment or if you're doing an intake. We have a psychiatry resident on staff at the Harris Center as well, and she'll use this room set up on the computer to do like telehealth appointments for med management. The rooms look very similar because they're all decorated similarly, but this is a different therapy room. So this is our 4th therapy room. And just a different angle of that. The child room does not have a computer in it for obvious reasons. We just want to make sure if we did have a kid who had more of a disruptive behavior problem that we weren't going to damage any equipment. But the other 3 rooms upstairs all do have this kind of testing station in it. Okay, so that was the best I could do with like a virtual tour that wasn't an awful shaky video. But happy to answer more questions about like the infrastructure or setup if anyone has them. But I wanted to review just a couple slides on what training at the Harris Center looks like. So as Dr. Carr said, students are in the Harris Center from years 2 through 4. Sometimes students will opt to continue seeing patients at the Harris Center in their 5th year. That's not required. It just depends on students' training goals and what they might be interested in. But you first start seeing clients in the Harris Center as a 2nd-year student. The services that we primarily offer are individual therapy and assessments. And of the assessments that we offer, most of them tend to be learning disability or ADHD evaluations. We can conduct other assessments. We just tend to not have very many of those. We seem to have a pretty good pipeline, though, of adult ADHD and LD assessments. So that's mostly the services that we offer, and I'll talk a little bit more about some of the other things that we do soon. The primary populations that we serve, so we serve adults, adolescents, and children. We don't currently do couples or family therapy at the Harris Center, primarily because we don't have supervisors who are able to supervise those specific types of cases. And of these age ranges, most of what we do see are adults. We see a lot of college students, just given where we're located, that we are housed as like part of UK, but we do see patients across the lifespan. In terms of presenting concerns that people tend to come to the clinic with, so we're kind of a general mental health community clinic. So we see a wide, oh no, sorry, my speaker shut off. Can you also hear me though? Okay. Yep. So we do see a wide range of different presenting concerns. So tends to be a lot of anxiety and depression is what so many people come in with, and that makes sense. That's kind of the most common presenting concerns everywhere right now, but especially being located on a college campus, we see a lot of that and work with a lot of that. We also see patients though with slightly more complex presentations like trauma or obsessive compulsive disorder or related disorders. I think we've had a few recently who had like trichotillomania or excoriation, so students can get experience working with that as well. We also see things like grief, adjustment to college or other life stressors. Some mild substance use, so we aren't equipped to, we don't have like a detox center or something like that. So if we do see any substance use cases, they do tend to be a little bit more on the mild side. Borderline personality disorder, we have a supervisor who's dedicated almost entirely to just working with BPD, relationship, interpersonal concerns, and then also behavioral interventions for ADHD. We do have a fairly diverse clientele. We see a lot of LGBTQ folks. I was actually surprised when I started how much of our wait list actually falls into that category. So we do serve a lot of LGBT folks in the Lexington community. We also have decent racial and ethnic diversity. I think it's representative of the Lexington population anyway. And we see a lot of cases who have autism but might be interested in working on something else. So that is something that you can get a lot of experience working with, even if it's not kind of the direct thing that we're like seeing them for. Treatment modalities that are offered in the Harris Center. So our orientation of kind of the program itself, but also all of the supervisors who work in the Harris Center, is cognitive behavioral therapy. So within that, you can also get experience doing ACT, acceptance and commitment therapy, some of those like third wave type things, motivational interviewing, and dialectical behavior therapy, or DBT, especially if you're working with Shannon, who does our DBT like treatment team within the Harris Center. So you can get a lot of experience in that. There are some new training opportunities that have recently started. As of this semester, actually, we will have a handful of new therapy groups. So on that first slide, when I talked about the services that we typically offer, we normally offer individual therapy and assessment, and we will now also be offering group therapy. So this is new. The Harris Center offered group therapy in the past, but hasn't for several years. I think that kind of stopped with COVID, and we hadn't fully picked it back up just yet. But the new groups that we will have and hope to continue to have in the future are a memory, aging, and cognition group, which is for a healthy older adult 65 plus who might have concerns about their memory, a social anxiety group, a general anxiety management / skills group, which is meant to be more transdiagnostic, a parent support group, so this would be for parents of kids with disruptive behavior disorders, and then a coping with depression group. Within the Harris Center, you can also get other training opportunities as well. So there are opportunities to get peer supervision experience that might vary based on the supervisor whose clinical team you're signed up for in terms of kind of how they structure their supervision. But with the therapy groups, I have implemented a peer supervision model. So for all 5 of the therapy groups, the facilitators are primarily students who are a bit earlier in their training, and all of them have an advanced student assigned to them that's doing like mid-level peer supervision. So students are getting experience in that way of being able to do this kind of tiered supervision. There's also opportunities to get involved in like research or outcome monitoring. Starting this year, we are transitioning our routine outcome monitoring from Titanium, which is our like electronic health record that we use in the clinic, over to REDCap. So it'll be kind of our new clinic database that we'll use. And for patients who consent to research, it'll allow us to much more easily analyze that data for research projects or just for program evaluation purposes, just to see like how are we doing as a clinic. One of the things I wanted to add too, so Justin went through that big list of all of the many different practicum opportunities that students have at UK. There are also practicum opportunities within the Harris Center. So there are 4 different positions that students can select to do like as their practicum. So we have the assistant director practicum, which is a 20-hour-a-week practicum for an advanced student, and it's mostly focused on things like program administration and management. So it's a really good practicum for students who might be interested in doing this type of job in the future, or who might be interested in like opening their own private practice. They get to see a lot of the behind-the-scenes stuff of kind of how a clinic works. We also have our clinic assistant coordinator, and again, these are all practicum positions you can choose to do at UK if you're interested. Our clinic assistant coordinator manages our undergraduate CAs, or clinic assistants. So again, those are the students who man the front desk, basically. So once a week, the CA coordinator runs a seminar. So it rounds up all of the undergraduate CAs and teaches them a class. So if you're interested in getting some teaching experience, that would be a really great practicum position to opt into. And the content of that seminar is largely left up to the CA coordinator. It's really focused on professional development, prepping for grad school, learning more about various topics. I know our current CA coordinator works with Shannon and does knows a lot about borderline personality disorder. And I think I sat in on a lecture once where he was just teaching the CAs about that. Then we have our therapy and assessment coordinators. So there's a lot of like small little administrative things that these coordinators do, like assigning patients off the wait list to different therapist caseloads. But there are various perks of being able to do these positions. So for the therapy coordinator, having more of like that first pick on individual cases to take, more priority in terms of group therapies that they might be interested in running, and the assessment coordinator spends a lot of their practicum days doing lots of assessments, and they get kind of the first pick on those assessment cases. For all 4 of these coordinator slash practicum positions, I work really closely with the students to try to figure out like what are their training goals and what are they interested in getting, and is it something I'm competent to supervise, and if so, how can we integrate that into their training? So the info here is very surface level. These are just generally kind of the things that they do, but there's a lot of stuff within this that can be personalized to your training goals. So our current assistant director is doing tiered supervision of 2 of our therapy groups because getting that experience was an important goal of hers. Our clinic assistant coordinator is now the clinic assistant slash research coordinator, which is brand new as of this month. So this our current CA coordinator was really interested in research and program evaluation, and so they're the one who really spearheaded this project to transition our routine outcome monitoring over to REDCap. And so now we have a new position that will be combined with another one of like who's going to help keep track of this research database. So that was his goal, to do something more research oriented. Our therapy coordinator is starting 2 of the therapy groups that are starting this semester. So she was really interested in that experience. So 2 of the groups are her like passion projects. Our assessment coordinator is also starting a new therapy group, the memory, aging, and cognition group, and has been doing lots and lots of assessments recently. So this can look like lots of different things, kind of whatever you want it to. Okay, that is all I had. Let me shift my... Okay, can someone say something so I can make sure I can hear, because my speaker shut off?
I can hear you. Can you hear me?
Oh wait, say something again.
Can you hear me?
Okay, I cannot hear. So let me fix this, Justin, if you want to take over for a second.
Sure. I mean, I think we'll just transition into questions. If you have questions for me or if you have questions for Amber, we'll do our best. And you can say them or you can drop them in the chat.
Okay, I am back and functioning, so I am happy to answer any questions that people have about the Harris Center or the practicum positions.
I have a question. Do all students get experience in assessment at the Harris Center? Is that more limited to only do a few like assessment evaluations?
Yes, so all students get therapy and assessment experience at the Harris Center. So there's a minimum requirement for assessment at the Harris Center. So all students must complete 4 comprehensive, like integrated assessments during their time at UK. And students vary in kind of how they space those apart. Some students wait and do most of them kind of later in their years. Some try to kind of get them out of the way and do them earlier. For students who are interested in assessment, that number can be like so much higher. We have some who are doing them like every couple of weeks, but there is a minimum requirement that you have to do 4 comprehensive assessments, and those are typically adult learning disability or ADHD evaluations. So you're doing IQ testing, academic achievement testing, that type of thing.
Thank you.
I have a question.
Yes, go for it.
Sorry, I didn't know if you could hear me. I was just making sure. So for the therapy piece at the Harris Center, how is that, and I guess the assessments as well, how is that supervised? Are you kind of directly supervising like after us as students would be doing these assessment and therapy sessions? Are you in the room? Just curious about that.
Yeah, so we have a number of supervisors who supervise cases at the Harris Center. So there's myself, Shannon, Mary Beth, and we have 2 other ones who aren't directly faculty in UK's program, but they have supervised a lot for us in the past. And so Lindsay and Elizabeth are the 2 new ones. And so whenever you are signing up for classes, you register for like different sections based on the supervisor. And there might be a lot of different reasons as to why you would register for one over another. It might be a scheduling thing. I can only make the supervision group of this one, or it might be like this supervisor is doing this thing and I'm interested in that, and so I want to sign up for theirs. And so you have a specific supervisor that you work with at the Harris Center, and that changes each year. You can like change who you're kind of signing up with. And so whenever you first start out doing therapy in the Harris Center, as it currently stands, all students work with Mary Beth. So she's like the 2nd year student person in terms of the clinical work. And the involvement that she might have in your cases can look kind of different. Like I know sometimes she might actually sit in with you during the session. All sessions are recorded, and so a lot of supervision takes place by like a supervision group after the fact. So you might have to show your tape, and Mary Beth will watch it and provide that feedback. Similar to assessments, when students first start learning how to do assessments, they start that in their first year. They're usually paired, usually if not always, paired with an advanced student who helps do part of that assessment. So there is scaffolding to help students who are just coming into the program feel more comfortable getting acclimated to doing clinical work, and a lot of different routes for how they learn to do clinical work, both in class, in the Harris Center, and in their external practicums.
Thank you.
Question. Do the treatment modalities apply at the center depend upon the supervisor that the student is working with?
Yeah, that's a great question. And the answer is yes. So all of the supervisors do CBT. So we want our students to have really solid, well-rounded training in cognitive behavioral therapy, and all students get that at the Harris Center. Depending on the cases that you're seeing and the supervisor that you're working with, you may be able to get experience in other treatment modalities. So I have a lot of training and experience in ACT, so most of the students that I'm actively or directly supervising right now are getting some training in that or implementing components of ACT into some of their treatments. I don't know that all supervisors have background in ACT, and so you may not, if that's something like you really want to learn, you may need to be a little more mindful of like who you sign up with to make sure it's with a supervisor who knows how to do that. If you're interested in DBT, your person is Shannon. She runs our like DBT clinical team. She works fully in that domain, and Alex can talk more about that later if you all are interested, because she's like actively doing that, right? So yeah, the treatment modalities depend on supervisor and also just the case, like what's going to be appropriate. But everything is rooted in cognitive behavioral theory. It's just the exact way that might look may differ a little bit based on who you're working with.
Quick question. How does the timeline typically work out for Harris Center versus external practica? So they said earlier that you do practica in addition to the Harris Center for years 2 through 4. So do you practice when do people typically pick up practica? Is it usually at the Harris Center? Do you usually find people go external? How does that timeline typically work out, do you think?
Justin, I feel like that's slightly more of a you question, if you know.
So if I remember correctly, it's funny. Is Alex here?
Yeah, I'm here.
Yeah, so you were at the Harris Center before you did an external practica, right?
That's right. So like basically all students are always seeing cases at the Harris Center years 2 through 4. The Harris Center can then also be your practicum site, or you could have a different external practicum site if that makes sense. But like, so like for example, I see 3 clients at the Harris Center, but then my practicum is at the Clinic for Emotional Health. Next year, I'm gonna like apply for a Harris Center practicum position, but whether or not I get it, I'll still have clients at the Harris Center. Is that kind of what you're asking?
Sure, yeah. And do you typically maintain a practica for that whole 2 through 4 years? 2 through 4 years?
I don't know if you want me to take that or you just
I can take that.
Yeah.
So that is actually at the discretion of the student. So there is a requirement of 3 practica in order to fulfill the responsibilities of the program. And also like you're going to want sufficient number of hours to ensure that you're effective in the match, which our students have never had an issue with the match, and they've never had an issue with getting good amounts of hours. But like, for example, some students who have goals for a research career may actually do a year when they do not do a practica. The reason I stuttered in terms of whether or not they do the Harris Center before the practicum is because students actually do engage in practicum early.
Mhm.
Like the orofacial pain, you know, and the counseling and the CEH, like people typically do those in their second year. So you've done 1 year. I think now I'm not a student of the program, but I think they'll have all done something in the Harris Center before they go external. Am I correct in that, Alex and Amber, or am I incorrect?
So, to some extent, so students will have training in the Harris Center for assessment in their first year. So they'll have interacted and been over here and seen real patients in that way. They don't start seeing therapy cases though until their fall semester of their second year. And so one thing that is kind of interesting about UK's program that was different from my graduate program is that when you first start seeing patients in the Harris Center in the fall of your second year, you can also take a practicum at the same time. So it's like the first time you're ever doing therapy, and you might be at the Harris Center and the Center for Emotional Health, or the Harris Center and the Orofacial Pain Clinic. That is up to the discretion of the student, though, and it varies based on training goals. So some students in their second year, they are just doing the Harris Center just to kind of get their feet wet. They don't do that external secondary practicum, but a lot of students do opt to go ahead and start doing practicum in their second year.
Okay.
Yeah, I
Yeah,
think
that makes sense.
Oh, sorry.
Please go ahead.
I think what you may have been getting at too, Justin, is there used to be a requirement that every student had to do a practicum placement at the Harris Center before they left. But from my understanding, that's no longer the case, just because there wouldn't, like, since there's 4 and then so many students, that wouldn't, like, there wouldn't be enough spots for everyone to do that before they go on internship.
Mhm.
Yeah.
That makes
So
sense.
I saw, sorry, I didn't mean to interrupt, Laura. Yeah. the
No
call.
worries. Thank you for the clarification.
I just saw another question here from Youssef Katab in the chat, specifically about KNI, the Kentucky Neuroscience Institute. Conventionally, that it doesn't require necessarily prerequisite hours, but it would require a prerequisite neuropsychology practicum, ideally, in order to arrive there. So that would probably be like the VA in Lexington, Eastern State Hospital offers some neuropsychological assessment opportunities. The reason for that is that for anyone who's ever been in a college of medicine, they move quick. You know, when I was at Harvard, they required 72 hours to post your notes, which was really fast in neuropsychology. When I was training, it was like do it in a month. So that changed a lot. So they have to operate on those demands. So that requires someone to be kind of ready for it.
I have a follow-up question to that. If you had assessment experience in neuropsychology prior to coming, would that count towards it, or does it need to be assessment experience while in the program?
I think we would decide that on an individual basis.
Thank you.
Like, I'll just say, like, one of the reasons the practicum sites are external, and we want you to be at a practicum site and succeed. So we want you to be able to go there and be ready to go. And like some of them are like the reason we have these early practicum sites like orofacial pain and counseling and CEH is it's actually really nice because they are ready for the fact that you might be very early. You know, whereas if you were to arrive at a site where they're like, we essentially want you to have a caseload and we don't want to give you that close detailed supervision, it would be like a sink or swim situation. So for some of them where it's like, this is actually a pretty demanding site, based on like a history with the program, Mary Beth knows that. And then when we're deciding on where you might go, we only want you to go to a place where you can succeed. Go ahead and if anyone has any questions, just speak up.
So my second question would be, do students have opportunities to fulfill different coordinator roles while they are in their clinical practicum? Let's say 1 year they want to focus more on research, but another year maybe they're more interested in general coordination teaching.
Yeah, so One thing that I think I'm struggling to explain a little bit, just because it is objectively a little confusing, is like the Harris Center practicum placements. So what Alex was saying about students have to be in the Harris Center just seeing patients from years 2 through 4, but we do also offer like external practicums. They're not actually external, obviously. It's like an internal practicum. So you wouldn't do like the orofacial pain clinic and be the assistant director in the Harris Center at the same time. So those are each different practicums. So you can only be in one practicum at a time, to my knowledge. I don't know that anyone would recommend doing like a bunch of practicum at once. So you would see Harris Center clients anyway, and you would choose to do a Harris Center practicum. So if you were more interested in that teaching, in your second year or third year, you might be seeing your clients here, and then also elect to apply for the CA coordinator position. And that would be your practicum for that year. And so then the next year you would apply for a separate practicum. Most students, Alex, you can maybe speak to this. I don't think students tend to do multiple Harris Center practicum placements. I don't think it's very common for someone to be like the therapy coordinator, and then the next year they're the assessment coordinator, and then the next year they do the assistant director position. I don't think that would generally be recommended. You want to get lots of breadth of training, so going to other practicum sites as well would be ideal, but many students do at least one of the Harris Center practicum placements. I don't know, Alex, you can jump in and add more. I don't know if I answered that great.
No, I think you're right. I was actually wondering the same thing myself, since I'm applying for Harris Center next year. Like, can you do more than one, like in subsequent years? So it sounds like that's not like prohibited, but like Amber was saying, you would probably like want to do one Harris Center position and then get experience at a different site, just like for the breadth of your experience, and also for your CV, having more places to list when you go on internship and things like that.
Thank you.
I have a question about the DBT training at the Harris Center. So within the DBT track, do graduate students also engage in phone coaching, or is it primarily just in-house?
Alex, do you want to take that one since you're actively doing it?
Sure. Yes, we do phone coaching. So we have an after hours phone that everyone third and fourth year, maybe fifth year, I don't remember. But at some point, everyone is required to have it for like a week at a time. And so if DBT clients call, they're instructed to say, hey, my name is X, my therapist is X, I'm calling for a coaching call. And then whoever is on call will let the therapist know, and they'll call the patient back. Sorry if that makes sense. That's a lot of calls going back and forth. But I guess the short answer to your question is yes, we do also do the phone coaching part of it too.
Awesome, that's great, thank you.
Yeah.
Sorry, I keep throwing you in there, Alex, but all the
No.
DBT questions, you probably know a lot more than I do about that because you're actually doing that.
I don't know about that, but yeah, I'm happy to answer whatever I can.
One question I will just throw out there. So someone had messaged in the chat, and it may apply to others, so I just wanted to answer it verbally too. So someone had asked about like if you are an international student, if you have trouble obtaining practicum placements through UK's program, and I would say the answer to that is no. We have several international students in our program now, and I think generally haven't had trouble acquiring practicum. I think one main limitation of that being I don't believe you'd be eligible for a practicum at the VA. There may be others that fall in that category too, but as I said, we do have multiple international students and have historically had several as well, and have all been able to get the training that they need and have been able to have practicum placements each year. So just wanted to answer that aloud in case anyone else was wondering, because I thought that was a really good question.
And we're actually at the 50 minutes on the hour. So we do in 10 minutes have another session on the specializations within the program. I believe the health one was rescheduled due to a scheduling issue, or not rescheduled, was changed to being distributed. Am I correct, Alex? Like the slides will be distributed because the coordinator was unable to make it due to a scheduling error. She's teaching at the time. It is not lack of interest or commitment. Yeah.
Yeah, that's right. So the next hour will just be on neuropsych, and then the slides that would have been presented for health, I will send around, as long as the contact information for some of the graduate students currently on that track. So feel free to email them. They said they wouldn't mind at all answering questions if the slides don't answer any questions you had about the health track.
Yeah. And I'm gonna drop my email in this chat as well. Amber dropped hers, so if you'd like to email me about and ask about practicum sites or questions in that regard, please feel free to contact me. If we're all good, I think we'll take a 10-minute break, and then I think it's the same Zoom room. And I'll just chat about the neuropsychology concentration for those who are interested. Even if you like don't have any idea what that is and you aren't necessarily applying to work with a supervisor in neuropsychology, you are welcome to attend. You don't have to be like, that's what I'm going to 100% do. Because sometimes people don't even know what it is and they might actually have some interest in it. So feel free to attend if you're like, there's no way I'm going to do that. Don't worry about it. See you later. It's no problem either. So other than that, all good. All right. See you in 10.
Thanks. Bye, everyone.
Bye.